I would like to thank this year's ICS Abstract Committee for the opportunity to present Abstract 16 from the University of Pittsburgh, entitled Low Pressure Voiding Induced by Pudendal Nerve Stimulation and Bloc using lead electrodes in spinal intact cats. I have no affiliations to disclose with respect to this work. We have previously shown that detrusor sphincter dyssynergia in spinal cord injured cats can be blocked with high frequency biphasic bilateral stimulation of the pudendal nerves using cuff electrodes. Also, we showed that combining this block with lower frequency unilateral pudendal nerve stimulation resulted in low pressure voiding in spinal cord injured cats. The objectives of this work are as follows. Number one, to determine if wire lead electrodes can block the pudendal nerve, and number two, to determine if combined block and stimulation of the pudendal nerve achieves low pressure voiding. This study was approved by the IACUC at the University of Pittsburgh. Under anesthesia, the pudendal nerves were dissected bilaterally in the sciatic notch, lateral to the tail for placement of wire hook electrodes. We performed two experiments. In experiment number one, with 4 cats, we tested the ability to block the pudendal nerve with wire hook electrode. In experiment number 2, with 5 cats, we tested if combined pudendal nerve block and stimulation resulted in low pressure voiding. With experiment 1, the design is as follows. 4 female cats were anesthetized using alpha chlorelose. A catheter was inserted into the distal urethra, 2 centimeters to the bladder neck, to perfuse and measure the pressure caused by EUS contractions and reflex bladder contractions. 3 monopolar wire hook electrodes were placed alongside the pudendal nerve, as shown here in figure 1. Stim B was the blocking electrode, delivering 1 kilohertz stimulation. Stim C is the central electrode, furthest away from the sphincter, delivering bursts of stimulation at 3T. And Stim D is the distal electrode closest to the sphincter, delivering a single burst to test if Stim B suppressed through complete nerve block or muscle fatigue. And as you can see here in our results, the 1 kilohertz stimulation, which is Stim B, delivered via the wire lead electrode, completely blocked the pudendal nerve conduction for greater than 2 minutes after terminating the stimulation, a duration long enough to allow voiding. And this partial block lasted for 6 to 18 minutes. And as you can see here with Stim D, which was given after the block, you could see that the Stim B resulted in an actual nerve conduction block and that the sphincter was not fatigued. Also, looking at block duration and amplitude based on this figure, you can see that the block duration did increase with increasing amplitude and duration of stimulation. Again, Stim B produced that complete post-stim block of duration of greater than 2 minutes. And at 4 milliamps, Stim B produced a prolonged post-stimulation block with a recovery period of 110 minutes. In experiment 2, the design is as follows. This was the bilateral block and stim. In another 5 cats under anesthesia, a double lumen catheter was inserted into the bladder dome with the lumen connected to an infusion pump. And then the other lumen was connected to a pressure transducer to record intravesical pressure. The pudendal nerves were exposed bilaterally for placement of either monopolar or bipolar wire hook electrodes. And with the bladder partially full, a 1 kilohertz block stim was applied bilaterally, and the 30 hertz stimulation was applied to induce reflex bladder contraction. As you can see with this figure, figure 4, our results from experiment 2 did indeed demonstrate low pressure voiding with the combination of the block stim, represented here by stimulations 2 and 3, and with the 30 hertz stim, which is stimulation number 1. Note that the 30 hertz stimulation number 1 by itself induced a very high pressure void, and that after the block wore off 15 minutes later, stimulating again with number 1 produced, again, high pressure voiding. With respect to voiding pressure from the combined pudendal block and stim, again, 30 hertz by itself produced high pressure voiding. close to 90 centimeters of water. However, when we combined the Bloc and the 30 hertz stimulation, it resulted in low pressure voiding, close to 40 centimeters of water, which is the same that was seen with the control on the left. And that furthest on the right, after the Bloc wore off after 15 minutes, the 30 hertz stimulation alone increased back up to 70 centimeters of water. With respect to voiding efficiency, again, the 30 hertz stimulation by itself wasn't as efficient as combining the 30 hertz stimulation with the 1 kilohertz Bloc, which did significantly increase voiding efficiency by 80%. And this was statistically significant. After the Bloc wore off 15 minutes later, the 30 hertz stimulation alone resulted in a 50% decline in voiding efficiency. So in conclusion, this study demonstrated that the pudendal nerve can be blocked by a wire lead electrode. Combining the 1 kilohertz Bloc and the 30 hertz stim in anesthetized spinal intact cats did result in low pressure voiding that was highly efficient. And neuromodulation to block DSD after spinal cord injury and to allow low pressure voiding might be achieved with the insertion of wire lead electrodes alongside the pudendal nerves using a minimally invasive surgical approach. And that concludes my talk, and I look forward to any questions. Thank you very much for your time today.